Hello, doctors. Welcome to Voice of Armenians TV New York. I'm sure today's interview will be very important for our viewers. And I want to ask you, Dr. Larry Najarian, to conduct this interview.
Thank you so much for having us. The Armenian American Health Professionals Organization is doing as much as we can to help our communities. And this interview is a part of that mission to help everyone, as many people as we can. It really is a pleasure to have our guest today speaking on such a timely topic. You know, this is a unprecedented time, and it has created a lot of pressures for many of us as we accept this unforeseen and unprecedented crisis with the coronavirus. Today, we're going to deal with the human side of this virus, how it impacts our souls, how it impacts our thinking. As we've been seeing through our hotline, which you're all welcome to call or contact us at info@ahpo.org, info@ahpo.org. Those of us that have issues related to depression will be more depressed. Those of us that have tendencies to be obsessive or anxious will be more obsessive or anxious. And those of us that have substance abuse issues, whether it be alcohol or drugs, will be driven to use these drugs and alcohol more than they have in the past. So there are a lot of issues that we all need to be aware of and extra sensitive as we interact with our loved ones and our friends. The other part of this is the isolation that we feel by not going out. We speak of social isolation, but it's really physical isolation. We still want to be social. So we are, again, very, very happy to have a very close friend and a mentor with us today, Dr. Louis Najarian, who's no relation to me. Dr. Louis Najarian is well known in the Armenian community for his unprecedented work with the orphans of Gyumri after the earthquake. And he has spent much of his life going back and forth to Armenia on his own time as a Fulbright scholar, working with these orphans. Today, he now is to the diaspora here, works in Long Island. He's known as a child psychiatrist, a clinical professor at the Zucker School of Medicine at Hofstra Northwell. Dr. Najarian, welcome to our show this afternoon.
Thank you very much, Larry. Thank you for having me, and I'm happy to share some of my thoughts about those of us here in the U.S. This is a different kind of trauma, a different kind of disaster, and there are several things we can do to help the people. But I'd like to begin with something most people have already heard about, but I just want to repeat it. What's guaranteed 99% protection against contacting this virus is just two things. One is not to touch your face, your eyes, your nose, your mouth, and your ears. And number two is to wash your hands. This is preventive, and it's almost guaranteed to prevent getting this condition. Now, the primary challenge that we're facing, as you said, unprecedented in the history of this country, from the Revolutionary War, the Civil War, the World Wars, at no time was the entire country shut down. So the first and primary challenge is to cope with this chaos. Whatever reactions we have, as you said, depression, anxiety, normal concerns, it's all reactions to an abnormal event. And something I find very helpful in a general way is to use the Chinese symbol for crisis. It has two characters. One character stands for danger, and the other character stands for opportunity. So this condition, this natural disaster, it certainly is a danger, but it has many opportunities to pull together and focus on what's valuable and what's important to us in life. But I've spoken to the group in the past about anxiety. And what is anxiety? Anxiety is a bodily experience of a worry, an unknown worry. We don't know what it is, and it has to do with control and danger. And it's expressed in our body with headaches, shortness of breath, stomach aches, tightness. But we can deal with this by taking control of what we can control. Now, we can't control this virus, but we can control what the doctors are telling us what to do as far as hygiene and as far as and I really don't like this phrase, social isolation. What I prefer is healthy space. How about healthy distance? It can still be 6 feet, but we are wired as people to communicate, to connect. So one important aspect is finding ways to shift our expectations, small breaks from the stress of our daily life. And just stop and think about this. A father is home working. Mother may be home working or not. She's got 3 children. Everybody's in the house. And what can we do about this? Well, first is to take care of yourself. The adults have to pay attention to their own minds and their own general health. But it's very helpful to avoid self-defeating statements, blame, complaining. President Trump didn't cause this. Nancy Pelosi didn't cause this. But there's some helpful thoughts. You can think, for instance, I often talk to children about changing the channel. When you've got an upsetting thought, change the channel. Think 5 years from now, how will this be viewed? A 14-year-old patient said to me, Dr. Najarian, you know, they're going to be writing about this in the history books. I said, you're right, Alex. Why don't you do a log? This is a 14-year-old. Do a log. Every day, write 1 or 2 things that were good for the day, 1 thing that could have been different. Or think of the good times. Look at family albums. Look at some things that were positive in your life. These are some initial comments I can make about how parents and adults can act, but I can't stress enough, adults are role models for the children. And maybe we can talk a little more about the children in a little while.
You developed a wonderful cartoon. So much has changed in the world. But the question becomes...
Here's the cartoon. It's a wonderful experience for the children. In that regard, Larry, people, when they say, oh, it's all over, things are never going to be the same, but it's only the activity has stopped. Life goes on. And you can ask children to write down in that little cartoon box, what are some of the things that are the same? They tell me, my house, my mother, my father, the dog, money, food. They're still playing Xbox. They're still playing Fortnite. So a lot has stayed the same, and that's what we got to focus on.
How does education help with this problem?
Oh, I can't stress enough. You're asking about education. Knowledge is power. Let me stress that. Understanding and knowing is power. It's very important for families to discuss with their children and encourage questions. Let me give you a good clinical example. A family in suburban Paramus or Long Island, mother of 3 children, a 15-year-old, a 10-year-old, and a 5-year-old, next door to a pediatrician. The 5-year-old wakes up with a fever, doesn't feel good, and has pox all over their face. Oh, kid has chicken pox. Mom says, you're going to be home for a couple of days until this passes. What about that same family in Kansas, 50 miles from the doctor, only child, wakes up, fever, pox all over their face. They don't know what it is. The main difference is knowledge. So expressing and explaining what this is all about is so important. And to address the fears of children, clarify their misconceptions. Every runny nose and every cold, every upper respiratory infection is not COVID-19. And children need to know that. And where does this come from? It comes from family discussions, which leads us to children. There are so many studies with children that when parents are anxious, children are going to be anxious. And if there's any one thing, you know, I keep thinking about that family again, this hypothetical family, dad is home working, mom might have been a homemaker and not working, but what if she's working? 2 working parents, a 4-year-old nursery school child, an 8-year-old elementary school, and a 14-year-old high school student. Everybody's home, the nanny can't come, the house cleaner can't come, Everything falls on this family. What do we do? To start things off is structure. Children need structure, adults need structure. And, you know, on the normal times, children are up at 6:30, they're on the bus at 7:15. Well, it can be a little later now. So this home learning, homeschool learning probably doesn't start till 9 in many school districts, certainly in Long Island, New York, and I'm sure it's the same in New Jersey. So kids get a break. They can get up at 8:30. They can have breakfast, get dressed. They have some time to play a quick game, but 9:30, everything's shut down. They're doing their schoolwork. Dad's doing his work. Mom's doing her work. The students are doing their work. They take a break after an hour and a half, 15, 20-minute break, they're back to work again. A break for lunch, and I stress to parents, during the long lunch break, let the children do what they want. If they want to play Xbox, let them play. If they want to go outside in the backyard, let them do that. It's important that they can work off some of that steam and frustration. So I can't stress enough structure. We are wired for connections. That's why this social isolation phrase, and I would keep repeating, safe space, healthy space. And there are restraints and difficulties with this.
Dr. Najarian, you raised some very, very good issues. I think what I heard you saying is to really help our children, we as adults first have to be aware of our own emotions and deal with our emotions so we can convey peace and serenity and optimism to our youth. Is that correct?
Oh, absolutely. That's what I said in the beginning. You've got to take care of yourself first. And that's there's a lot of restraints on that. And I'll get to, maybe we can discuss it now with the parents and the adults. This quarantine can contribute to marital discord. And as you said, anxiety and depression, increased use of alcohol, increased use of smoking, whether it's a substance, illegal substances. And it's so important that they be aware of that and they address that so it not interfere with the children, because anxious parents will have anxious, worried children. And it's unfortunate because some of the usual activities and hobbies, father can't go play golf, mom can't go tennis, dad can't get together with his buddies on a Friday night card game, or they can't go to dinner with their friends, or the usual kinds of activities to be social beings are all taken away. So one has to improvise. We can use the internet, we can use Zoom or FaceTime or Skype. We've got to be creative. This is one time when it can be helpful. I'll give you an example. One of our grandchildren is a junior at college, and they're using Zoom. So 2 weeks ago, she set up a Zoom family meeting. Her family, her 2 uncles, and us. So our 3 families, our 8 grandchildren, we had a 45-minute get-together 2 weeks ago. This past weekend, a 13-year-old had a birthday, so we Zoomed with about 20 people. So these are available to us, and we have to make the best of it. But after the parents have dealt with some of their own issues, which I'll get to later, it's important to the children to talk process, not the event. What I mean by that is not the body bags on television, not the pictures of these emergency rooms that are overcrowded, but to signify the importance of what's happening. People are sick. The doctors are taking care of it. We have the best doctors in the world doing what has to be done. And we have to discuss it in a language the children understand. And another pearl for the parents, over the dinner table, the phones should not only be shut off, but put away. Even if a phone is shut off and in a child's pocket or in their lap, they're distracted. When they're put away, then they can really focus on what's going on. Let me give you an example of another research. 30 children, about 10, watched a movie that was somewhat stressful. And then they were given their cell phones to text their parents to say, we were upset, we didn't like it, one girl cried. And then The parents responded. 15 parents, they all said the same thing, but 15 parents read a text. The other 15 parents spoke. Now you can guess, those 15 children heard their mother's voice saying the same thing. Their heart rate, their blood pressure, their pulse, their galvanic skin response all diminished significantly compared to the others. So communication in the way that children understand it is extremely important. One other aspect about with children, and adults too, but especially children, it was clear after 9/11 when there were frequent showings of the planes hitting the towers. Constant exposure to that was really a risk, increased risk for PTSD. So if we're constantly showing body bags and showing really unpleasant, catastrophic things, it's unpleasant and it doesn't help the children process it. That people are sick, and it's clearly young people do much better. It's people who have other conditions. This can be explained in a way that's understandable. But I can't help but stressing to ask questions, and there are two aspects of this. When a child is angry because they can't play with their friends, or they're missing soccer, or a girl can't go to her dance, or they're missing their usual activities, they're sad, they're angry, or they have a short fuse, it's important that parents, number one, validate it. Yes, I know you're angry. I know you're sad. You're upset. I miss my tennis. I miss going out with daddy on Saturday night. Validate it and then stress it'll pass. It always does. And we can use art, music, writing as vehicles to be able to help pass some of this time.
Dr. Najarian, it's very interesting as I speak with you. You seem to have such a good feel for children and their emotions and how they respond to events like 9/11. What parallels, if any, are there between 9/11, what's happening now, and the earthquake in Gyumri, and how has that impacted on your understanding of issues related to the children?
Well, that's a very important, interesting question because there are disasters. Natural disasters can be an earthquake or flood. Man-made disasters can be terrorism, as one example. Or there are accidents. This would fall in the group of accidents because the enemy is invisible. So that makes it more difficult in some ways. But the reactions have to do with events that remind them of the trauma. Seeing sick people, seeing constant numbers. So they would have what we call re-experiencing or avoidance, avoiding things that remind them of this. And they could have what we call physiologic reactions. They could startle when there's a news event or some other thing that might be reminding them that we heard somebody died. Or so there's similarities. But the differences are this one is invisible, and this is affecting everybody. Most natural disasters are certain specific areas, and they can be isolated and dealt with, whether it's in Armenia, whether it's in Iran, or New Zealand, or in Sandy in New York, or Katrina in New Orleans. These are all have different contexts, but the reactions of fear, worry, it happening to me, these are similarities, but the children can be helped. One important way to help with this is with that busy household. You know, everybody's home on top of each other. The cleaning lady didn't come, the housekeeper's not there, so we all have to do it ourselves. But it's very important to convert some of the passivity of boredom to activity. Everybody should have a job. Children can set the table. Somebody can clear the table and put them on the sink. Someone can load the dishwasher. Somebody can bring the laundry down. Somebody can work the vacuum cleaner. It's very important. Yard work, it's springtime when the weather's nice. Children can get out in the back with a rake and start cleaning up. It's really important to delegate jobs. And one important aspect, I have to, one of my favorite stories is about make your bed. And I used to make my bed every morning and I never knew why. Well, from the time I was in college, medical school, and I still make my bed if it's not me. Well, somebody gave me a book called Make Your Bed. And it was written by a former Navy SEAL who wrote about some of the experiences in his training and his deployments. And now he's a president of the University of Texas. So he indicated how they were required to make their bed every morning, but it helps you to organize your day. When you make your bed, it organizes your day, and in making it, you can plan, what's my schedule for the day? Well, children, most 8 and 10-year-olds can make their bed. Doesn't have to be perfect with hospital corners, but it can be done and they're thinking about what they're gonna do, because then they're gonna go have breakfast and get ready. And at 9:30, they're gonna start their work. So these are important little tidbits, but boredom, loneliness, regressive behavior, temper tantrums, bedwetting, wanting to sleep with the parents, stomach aches, parents should go with the flow. It's okay to tolerate it. Kid wants to come and get in bed with you at night. This is unusual times, and these are things we might tolerate.
Well, thank you. The next question is a sensitive area about substance abuse. It can happen in the parents. It could be a problem with the children. And now many children are coming back from college or sleepaway schools. How do parents deal with these issues of substance abuse?
Well, not only substance abuse, but the sale of alcoholism has gone up statistically during this time. So people are drinking more. That's one way to take the edge off. There are some better ways, but how do we deal with it in high school and college students? Well, pre-COVID, there's becoming in the last year several examples and brief studies about children, teenagers, and college-age students where they're vaping and they're juuling, and they're really causing damage to their lungs. And so they are like some of these elderly patients who do have chronic obstructive pulmonary disease. So when they're exposed to the virus, they're not going to have the same kind of resistance that they ordinarily would have. So I can't stress enough, these are signs and they require really consequences. And it's a little easier for parents for consequences now because they can control it. The children can't use their credit cards injudiciously. People aren't coming and going. So where are they getting their supply from? And you just have to be very strict and secure about it. There's no question about that. It's another important aspect of this. We'll get to some more aspects of what to do. But quarantine is something I wanted to talk about. It's important for families to know why we quarantine, to really understand it. They're not being punished. It's coming from the doctors, the experts, and our government officials who are really basically trying to save lives. And this seems to be working. So it's important to understand there's a scientific basis for it, for our well-being, even though we don't like it. And it's unprecedented, as you said. It's important to have supplies. It clearly has shown the shorter the quarantine, the less psychological distress. There's another aspect of quarantine, altruistic component of quarantine should be stressed. Now, what do I mean by that? Helping an elderly neighbor, calling them. Can I help you? You don't have to get within 6 feet, but you can ask, what do you need? Can we get you anything? Can we help with supplies or anything? Let me tell you what one mother did of one of my patients. Never left her house. She sent blast emails to some of her friends, some of them very wealthy. She raised $17,000 to feed the front lines. Within about a 10-mile radius of where we are in Long Island, there are 5 major hospitals: St. Francis, Glen Cove, North Shore, Long Island Jewish, and I'm blocking on the other one, Winthrop. Five excellent hospitals. She had the delis and some of the supermarkets prepare packages of lunch and food and delivered them to the emergency rooms. That's an altruistic thing, and the kids helped out, and the kids could help out. So there's another concern, the millennials, the 35 to 50-year-olds. This is the first experience for a generation from major challenge in their lives. We call them being raised by the snow-plowing parents. They didn't have to be too concerned about much. And this is a little rocky. And that's why one statistic that I do believe from China, I don't believe a lot, but one thing I do believe, in one province in Wuhan, after 3 weeks of quarantine, the divorce rate went up 300%. In one particular government office, in one day, 15 couples showed up requesting divorce. Of course, the government said, go back, work it out. But why does that happen? The usual opportunities we have for recreation, to deal with stress, whether it's our boss at work remotely, or whether it's the kids getting on a mother's nerves, we don't have that break. So what do? Well, there are several things we can do, and I wanted to get to that. What are some of the things we could do? Well, one interesting therapeutic approach called ACT, Acceptance and Commitment Therapy. There was a beautiful essay in the New York Times about 3 or 4 weeks ago in which a woman, a successful journalist, had written about her anxiety. She had anxiety since she was in high school, college, graduate school, and now a successful journalist. And she found this therapy that basically helped you to accept it, identify it, and go forward with it. And basically teach you that life can be hard. Negative feelings are part of life. You got to accept it. So what did she do? She named it. She called it Susan. And she'd be working or in a social situation. The anxiety would build up. He said, oh, Susan, you're back. Susan, why don't we have a cup of tea? She would turn the channel. She'd have a cup of tea and kind of just meditate and be mindfulness with some training, which I'll get to. And it passed. She left it and went back to her work. Now, what else can we do? There are some other specific things I can suggest. Short of for a serious depression or a serious major nervous breakdown, I'm talking about the masses and most of us in the population we're talking to. We can do mindfulness training. We can do diaphragmatic breathing. We can do progressive muscle relaxation. These are all exercises. And mindfulness training is like meditating. It's almost like praying. And I have to, not to get particularly religious, but I'm currently taking a Bible studies and we're reading Matthew. In I think it's the 3rd or 4th chapter. They're talking about anxiety. Don't worry about tomorrow. Worry about today. They're talking about being mindful. And all of these things I just mentioned, mindfulness, diaphragmatic breathing, progressive muscle relaxation, these are all very good. They're all on YouTube. Just put it in on YouTube. You'll see beautiful demonstrations of it. One suggestion to couples. An old famous philosopher said, couples don't have to think alike. They have to think together. So you can think, you don't have to think alike, but when it comes to dealing with this current situation, you've got to really buckle down and you've got to think together. Another philosopher said, if I never fell, I wouldn't get up. If I never sat on the darkness, I wouldn't appreciate light. Let me tell you another real story. It's very germane to dealing with stress. We all know who Robert Louis Stevenson was. He was one of America's first playwrights. He wrote Treasure Island. He wrote Robinson Crusoe. What nobody knows is, most people don't know, he had tuberculosis then. And in those days, you went to a sanatorium. You either died or after 6 or 8 months, your body would overcome it. They didn't have streptomycin or antibiotics to deal with it. And he was one of those fortunate ones that being isolated, being out in the Western Massachusetts in the clean air of the Berkshires, he recovered. And then being a more passive kind of fellow, he wrote. And then he became very famous. So he went on the lecture circuit. And he would begin every lecture the following way. He would say, folks, life is not a matter of being dealt a good hand. It's playing a bad hand well. Folks, we're all being dealt a bad hand. It's up to us to play it well. All these challenges, medically, psychologically, all these challenges can be engines for growth. And when we've overcome this challenge, we will all grow and be better people. So I can't stress enough. So I'd like to finish with what I started with. Again, prevention. Guaranteed 99%, two things. Don't touch your face, your eyes, your nose, your mouth, or your ears, and wash your hands. And I want to thank you, Larry, and AAHPO, and Najarian to give me this opportunity to share some of my thoughts. And you said it, but I want to stress again, the AAHPO website is very inclusive. Everything I've said is already in there if you want to take the time to read it. But there's one particular thing that I've sent to many, many families. There's one of the emails has to do with 50 things to do. Many people have done 4 or 5 or 10 of them, but it's very enlightening to see there's so much more we can do to help pass this time away. So I would encourage everybody to look at that AAHPO website.
Well, thank you very much. We're speaking, our audience today has many different backgrounds. Some are second generation Armenian Americans, some are just came here. Can you speak about the ability to reach out for help and speak with a psychiatrist or a psychologist or a social worker trained in these issues? Because I know there seems to be some barriers to it. Can you address those barriers?
Well, it's a problem because it has to do with culture. It has to do with culture, and I can tell you in the beginning, way back in Armenia after the earthquake, people were initially very reluctant to come out and talk. But that was to the Armenians trained in the Soviet system. When they saw the confidentiality and the trust in those from the diaspora, it was floodgates. And now there in Armenia, the way it started, when we started after the earthquake in the late 80s and really in the early 90s, it was similar to the way it was in the 50s and 60s years towards seeing a therapist. Oh, we don't talk about that. But now in Armenia, it's in vogue. Everybody talks about my shrink said this or my psychologist said that. So they've come around there. The more recent arrivals, the only way one can go about that is to deal with whatever they're bringing to the doctor. They're going to bring headaches and stomach aches, and they just don't feel right. And you got to start off with the physical symptoms. But something I can tell you about people who've come recently from the Middle East and Armenia, they have much more experience in dealing with trauma. And compared to what some of them have been through, this is relatively mild. We still have water, we still have electricity, we still have heat, we still have all of the conveniences of life. It's not like in the earthquake until the 90s when I lived there, water would be rationed 4 hours a day and mothers would do the whole work in that 4-hour system, or you had electricity 4 hours a day. So I wouldn't be so concerned. They tend to be a bit more resilient, but the only entree is going to be where they come to us. They're going to come to you. They're going to come to the primary care doctor. And that doctor has to be very sensitive from where they're from, and then to gently get into what's going on in the family. And the first thing they're going to say is everything is normal when nothing is normal. And then they're going to have to really kind of tease apart. So my comments are really towards the medical profession, because I'm not so sure the listeners would be so quick to call you for a referral to see a psychologist or a social worker.
Well, thank you very much. This was a very informative interview. It was inspiring. A lot of positive ways to look at the bad hand that we've been dealt with. As this goes on longer, we need to look at these positive ways and find ways to stay active. So when we come through the other side, we'll all have very happy families and still go to church, and life will be like it was.
Yes.
We'll get there, and we're
Yes.
going to get there together. In the meantime, we have to be as social as we can, but from a distance.
Yes. Okay, thank you again.
And thank you for your years and years of service, of dedication to our community, and thank you for all the volunteer efforts that you've put forth so far. You're the best.
Okay.